Hi guys. Oh, I have this mascara on. I didn't. Let me just remove it. Yeah, thank you. Hi guys. Welcome into the live. My name is Dr. Magda Matanis and I come to you from Israel. So, today I have for you a patient experience. Ken has offered himself to tell me about his experience after a surgery. Hi Ken, welcome. I will add you just in a bit. Uh, I will actually just add you now so you can tell it yourself. Let me see. Just a moment. Okay, I added you who are online. Welcome Iyad, welcome Azmi, welcome Ken. So yalla, join in. Ken, I already sent you hi, Maisa. Share, tag your friends if they are gonna benefit from this live. I will see. Ken, I already. So thank you all for watching and your patience. Yeah. Let me wait. So Ken is from Australia, and he passed a surgery for pituitary adenoma 2 weeks ago. Hi Ken, welcome into the live.
It's great to be here. I really thank you um, for the interview and the introduction.
It's
Blessings,
very
blessings to everyone on your Facebook from Australia.
thank you. I just hear there is an echo, so I hear my voice in the live.
Yeah, do you have
Is there
earphones?
a way that you? Hello? Can you?
Do you have earphones?
Yes, I am on my ears and my earphones, and actually now it's better.
Okay. All right. Let me get off this. I need to. I'm trying to. Okay. Now I see what's happening. That's better.
Yeah, I can listen to my voice clearly and to your voice clearly. So it's
That's
cool.
great.
Thank you for joining. Thank you for joining and coming forward with your experience. I know that it wasn't easy for you, and it was a challenge. Can you tell us a few words about? So I'm just gonna introduce you. This is Ken from Australia and New Zealand, so the other part of the world. But and the in the past 2 weeks, it was 2 weeks ago, right? Or how long? So
Yeah.
he passed a surgery for pituitary adenoma, and he posted some pictures about his experience on his Facebook. So it's with fully your consent to come forward and to actually tell your experience. So can you tell us a little bit what happened and how were you feeling?
Yeah, well, 6 months ago, I was diagnosed, surprisingly so, with a brain tumor, and I I
Can I
was in.
just can I just tell so the audience don't feel it's a brain tumor, but there are also benign tumors and malignant tumors. So and I see that you got scared. You said that you were scared about the diagnosis. So can you? So it's not every tumor is a malignant tumor. That was important for the people to know. So
Yeah,
so they want
absolutely.
to
I
be
mean,
scared of.
initially when I heard the name brain tumor, that was the first thought that came to my mind, knowing which one of the two that it was. It was still a frightening experience to know that when the name brain tumor comes up, you kind of automatically think that it's life threatening of some sort until the doctors are able to diagnose it and tell you that it's a benign brain tumor, but
So,
nevertheless, you still have to go through the whole process.
and how did you feel when you knew that it's just a benign tumor? Because pituitary adenomas are benign, but I will explain to you after. So tell me more. Tell me more.
When I first got the diagnosis that I had a brain tumor, and then they told me that it was a pituitary gland, I really knew very little about it. All I knew that it was related to the brain. Yes, of course, I had some concern, but I kind of received the news um, a lot better than what I would have thought at that particular time. And what happened was I was in a shopping complex and I was at a cafe within the coffee, and then my eyes
Before
blacked
that,
out.
before that, what made you feel a little bit at ease?
I was getting
What?
migraines. I was getting headaches. They started reoccurring, like most days. Um, Previous months, years, there was like one, then another one, 2 days later, sometimes a week later. But then I say probably the 2 weeks before I lost my eyes for 30 seconds, I was getting the migraines quite badly. But even at that time, I didn't go to the doctors because I thought it was just a headache, a bad headache. And so when I lost my eyesight, I immediately went to the emergency hospital. And that's when they diagnosed me and they said that I had a benign pituitary gland, brain tumor.
Okay. So you, in the emergency, you were on the MRI. So you passed an MRI test for the diagnosis, which is the best diagnostic tool for pituitary adenomas or any structural abnormalities. I just want to add about the headaches. So you experienced headaches before that, and I want to tell the audience that not every headache that you pass is about a tumor. So because there is specific qualities. For example, the pituitary adenomas, they are usually recognized as a headache, but not that very specific. Like the quality, you won't be able to determine. Sometimes it will appear for 1 hour, sometimes it will appear for 2 hours. So you can't follow through with the quality of the headache. But for migraines, people who have migraines, usually they have a characteristic type of migraine. It will appear like a prodrome. Prodrome headache, it's called, that they will feel like food cravings, they will feel depression, they will feel that there is something about is going to go on. And after that, there is the aura. So there is a characteristic way of having a headache. And usually the migraine is about for 1 hour, usually the aura, headache in the aura. So you will see, photosensitivity. Sometimes the headache of the migraine, it's important to differentiate for the people who have suffered so much from migraine and from people who from like in your case, it was benign, and thank God it is benign, but the headache wasn't that specific. So it's important to notice if this is a recurring symptom, that it appears all the time. Migraine is unilateral and appears for about 1 hour and then has an aura, photosensitivity, phonosensitivity. And in the pituitary type of adenoma, there is not such characteristics. Of course, ask an experienced doctor for that. But from what I learned and from what I know, the pituitary adenoma headaches are not that quality specific, whereas the migraine headaches are quality specific. So, so you experienced headache. Ken, and after you had a visual loss for 30 seconds.
Yeah.
So, and it was by chance. By chance, you were like in a mall, and you experienced loss of vision for 30 seconds, and this scared you a lot.
Yeah, well, it really did. I think that was probably the scary moment. You know, when you're sitting in a cafe and you have a coffee and you have a muffin in your hand and you're just looking, doing the normal thing, and you're looking around, and then suddenly you can't see anything. And then you start to think, what's happened?
Wow.
Because everything shuts down. It just becomes pitch black. And the immediate thing is there's something wrong with your eyesight. And I didn't connect it. I didn't connect it with my brain until I went to the.
You shouldn't. You're not a medical doctor.
No,
You shouldn't.
Yeah, but you know, but at that particular time, you're trying to work it out. You know what's happening in that moment, because when you're in that moment and when you're in that zone, you immediately you're happening. Because you don't.
Yeah, you got flashback. Like what's happening? Like what? Like I can't see. Oh my God. Can you just check the audio, because I listen to my voice again.
It's fine on my end. If you've got earphones, I just think that it's going to have little moments, but I kind of think it's okay. I think it's just a movement of.
Okay, let me see. I will take it off. Yeah, technical. But still, I can listen to it. Sorry about this. Please forgive me, guys. But if you put
the earphone in properly and you kind of keep still, it's moving with your computer.
Hello?
Yeah, when you touch it, that's when it starts to make noise. You just got to let it go.
I let it go.
Yeah, that's good.
But still.
It's better.
Okay, so I can.
Don't touch it. Just don't touch it. Yeah, what's happening is you're touching your cords. That's when the noise comes. You just gotta talk for it and don't touch your earpiece.
I remember. I hope that. But let me we can. But anyway, so let's continue. Hope it will be better. So I don't know why.
Maybe we start again, huh?
Yeah, I don't mind. We can do it.
Yeah, we'll have to start again, but when you get your earpiece, keep it still.
Don't worry. Let's start again. I will end this live and start another one.